Hi, everybody. What's up? I'm DJ Sixsmith. You're watching the Sit Down. Absolute pleasure to be joined by Dr. Pat Basu. He's the CEO of the Cancer Treatment Centers of America. Dr. Basu, welcome. How are you?
I'm doing well, DJ. Thanks for having me on the show.
You got it. So there's a lot I want to talk to you about. And obviously, we're living through a really crazy time right now with COVID-19, and that can take up enough of your mental capacity. But you're thinking about the world of cancer every single day. You're thinking about cancer patients and screening. So really broadly and generally, how has COVID-19 impacted the cancer world, in your opinion?
Yeah, DJ, you're right. Obviously these are unsettling times for all of us, but particularly in the world of cancer, it presents some unique challenges. Look, first of all, I have the privilege of meeting and talking to so many cancer patients, as a part of my job, and they are just an amazing group of individuals. They're tough, they're hardy, they're hopeful, they're resilient. But it's definitely been challenging to speak to so many patients during this COVID pandemic because they just have a lot of questions, right? And I feel privileged to be able to try and answer a lot of their questions and have many of our physicians do the same, but they are in many cases choosing between, or at least trying to sift through the noise of what's true and what's not, and certainly the reality that obviously cancer does predispose them to an immunocompromised or an immuno deficient perspective, and that weighs on them. So many of them are having to choose between, do they postpone or delay their life-saving therapies and diagnoses versus some of the risks that are intrinsic with COVID-19. And I think the main message that I'm trying to get across to them is yes, we have to be cognizant of both of those, but we don't need to choose between two extremes.
What would you say are the most common questions you guys are getting these days?
Yeah, the number one question would probably be, is it safe for us to, continue our therapy from a cancer perspective? We also, would definitely get questions along the lines of, something more specific around, I was told by my doctor that I can wait for this type of therapy, or can I switch this or delay that? Some sort of alteration in their current, cancer treatment regimen is another common question. But certainly a lot around continuing their treatment during COVID. And as a general rule, DJ, for the past, 20, 25 years, the bedrock of cancer care therapy has been catch it early, treat it early, and treat it completely. And that really has not changed. COVID-19 is clearly an incredibly serious global pandemic, one that deserves, our full, focus and safety precautions. But, cancer patients have had to deal with this and other issues, frankly, for some time, right? There are other infectious diseases that, can sort of disrupt or potentially disrupt care. And it's our job to make sure that that patients get the care that they need and they don't get their care disrupted.
You make a lot of really good points there. And I know you've written about this also, just this shadow curve that could potentially come in here in terms of the impact of COVID on cancer. And when you think about things long-term, like what scares you the most? Because cancer patients have a lot of fear and anxiety. What keeps you up at night when you think about, okay, this goes on until the end of the year, into next year? Like, what are the biggest concerns you have?
What keeps me up at night, DJ, is, as a physician, as a CEO of of the only national cancer organization, I fear a study being written in, let's say, the year 2023 that looks backwards at the preceding 3 years and says, 1.8 million Americans will be diagnosed with cancer every single year. Let's just say over those 3 years, it's a sad fact, but that would be, close to, 5 million, patients that would have diagnosis. What if, due to disruption in cancer care, what if 1 million patients miss their diagnosis of cancer over those few years? what if hundreds of thousands of deaths, were caused because the disruptions in cancer treatment? What if, how many weddings, grandchildren's baseball games, births, would be missed because of those things? Or all the stories that I hear when I talk to our patients about how fortunate they feel, how lucky they feel when they've survived their cancer, I think about sort of the opposite, the mirror image. And that really worries me. It worries me because in medicine, we often write these studies where we look backwards and we say, geez, we didn't realize this was happening. And I want to try and look forward and say, how do we prevent that? And so I've had this term I call the shadow curve, which is this idea that we're trying to flatten and clearly eventually diminish and extinguish the COVID curve. But because of all the disruptions, there is a rising, kind of less visible, less notorious curve, which is all the other healthcare conditions that we have to keep battling even during COVID: cancer, heart disease, other chronic diseases. And so I sort of think about the shadow curve as this tidal wave that's rising in the background. And I want to just alert everybody that we need to pay attention to not just flattening, but really pushing that other curve down as well.
Yeah, there's clearly a lot going on here. And it's really interesting because all the focus and attention is on COVID. But like you said, millions of people are dying every single year from cancer. And then also you think about just the resources that are going to COVID right now, the financial resources that are going to COVID right now. I would imagine there's some people in the cancer community that are like, hey, we've been trying to solve cancer for a really long time. So what's it like having those conversations where, of course, we want to figure out how to end COVID here, but like, can you throw us a bone in the cancer community? How do you guys think about that right now?
Yeah, the metaphor of war has been used for these diseases for some time, right? The war on cancer, the battle against cancer, and people have called it the war, the war on COVID. To stick with those themes, there is such a thing as a two-front or a multi-front war, right? We don't just say, I've had patients in the past that I've had the extreme privilege of getting to take care of that fought in World War II. And, there was operations in a war going on in Europe and operations in a war going on in the Pacific, right? And so lesson number one to me, DJ, is you never just completely turn your back on one side, right? You don't just say, we're turning our back on the war on cancer, right? So that is paramount. And it's as stark as I sort of made that sound, it kind of has happened. A lot of patients have been disrupted. And you're exactly right. Resources have been diverted away in terms of clinical resources, in terms of capacity, in terms of access, clinical trials. But also our attention has been, diverted away in terms of the focus. Cancer is not one of those diseases you ever want to take your eye off. You always have to just, consistently stay on it, on every aspect of it. So I'll give you a couple of concrete anecdotes. I talked to patients who they early on in the pandemic, they read maybe a decree from a governor and it said, all medical procedures are halted, right? And they didn't know, well, does that apply to my cancer therapy, right? And of course the answer ended up being no, but they didn't know that. Another patient who spoke to me that the hospital that they were going to was, a terrific hospital. I know their CEO was in the throes of battling, or getting ready to battle, COVID patients coming through the doors. And they made a move that basically kind of shut down all of their other operations. So this patient couldn't get in to be seen for their cancer therapy, right? And imagine the angst of just all of a sudden having, that type of interaction. And so, yes, there have not in the past been enough. There has not been enough focus and resources and attention, even in the past, to fight COVID or to fight cancer as it is. That during this time, it's leading to a lot of disruption. And to give you a few figures, a recent study showed that roughly 80 to 90% of screenings were being missed in terms of mammograms, colonoscopies, prostate examinations, and that just in the first few months of this COVID pandemic alone, that perhaps more than 100,000 cases of cancer could have already been missed or delayed.
Wow.
And so, we're really worried about that impact, because catching a cancer early can not only mean the difference between life and death, even in saving one's life, it can mean the difference between catching something at stage 1 versus catching something at stage 3, and just having to deal with a much longer, more invasive therapy. And we at Cancer Treatment Centers of America, we look at every patient as if it was your mother, your father, as a human being. And when you put it in that context, you think about every one of those patients being potentially disrupted. It's tragic, and it's heartbreaking.
Yeah, there's a lot of really difficult decisions to be made, a lot of challenges going on, and that's the fight we're in right now. And, you've been in this fight for a really long time. Your medical career has taken you all over the country. Got the opportunity to work in the Obama White House, and I'd love to just talk to you about that for a moment. What are you most proud of, and what was the best part of that experience for you?
Sure. Well, maybe just as a brief segue to that, it's as I look at some of the discussion going on right now, DJ, it's been disappointing for me to see that this issue around COVID has been framed as sort of health versus the economy, or lives versus the economy. As I just shared with you, it's really one about health versus health, or lives versus lives. And I think people need to look at it that way, right? If you're a cancer patient, you're being disrupted or don't have access to care, that's not an economic consideration. That's a healthcare consideration. So to come back to your question, what really stood out for me, working in the Obama White House. First and foremost, I love this country. I think when we are at our best, the United States of America can be that city on a hill, can be an example, past, present, and future of how a society and a nation can be. And to be able to work on some of the country's grandest challenges and toughest problems was just really, really fulfilling, and a feeling of great, patriotism to be able to devote time, energy, focus to those types of problems. And specifically, so many things stand out. I had tremendous opportunities to do my small part in being a part of discussions that impacted healthcare, in terms of expanding access to tens of millions of Americans. During that time, it was in the throes of the Great Recession,
Mm-hmm.
and to work on programs that helped get Americans back to work, and get people who were unemployed, and give them a chance to be employed again, was just incredible. And then I had an incredible interaction just getting to work very closely with military officers, and just really, I've always had such an appreciation for what our military heroes do, but just being a part of conversations and decisions up close and personal, just it really just made me proud to be there, and I have some incredible stories, some of which are tragic. Getting invited to a funeral of two brave servicemen at Arlington National Cemetery. Just it's a feeling I'll never forget, and it's one that I think about a lot in terms of just how grateful I am to their service, and how proud I was to be serving at the White House, trying to prevent any unnecessary deaths into the future.
Well, I think the one thing that's clear talking to you, Doctor, is that you focus on the people and not just the numbers. And I think that goes a long way, and really thankful for all the work you're doing. Thanks so much for joining us, and best of luck with everything. Really appreciate it.
Well, thank you for having me on the show. I think you're exactly right. When healthcare is at its best when we think of people as people rather than people as numbers. So I appreciate you calling that out. Thanks for having me on the show, and it's great to be with you.